How are core exercises related to hip pain? Have you ever wondered how core exercises can impact hip pain? It might surprise you to learn that the connection is quite significant. The core muscles are essential for stabilizing the pelvis and supporting hip function. When we talk about the core, we refer to the muscles surrounding the trunk and pelvis, including the abdominal muscles, lower back muscles, and hip muscles like the hip flexors and extensors. Strengthening these core muscles can greatly influence how the hips function and may even help reduce hip pain. A strong core helps maintain proper alignment and balance during movement. This means less abnormal stress on the hip joints. When the core is weak, the hips often compensate by overusing certain muscles. This can lead to muscle imbalances and increased strain, which can cause or worsen hip pain. For those pursuing careers in sports, athletes and strength and conditioning professionals focus on core strengthening exercises to improve hip stability and function. This is vital because stable hips support efficient movement patterns, lower the risk of injury, and can alleviate existing hip discomfort. For instance, exercises like side planks not only strengthen the core but also engage the hip stabilizers, showing how core and hip strengthening overlap. Research shows that core strengthening programs can modify the balance of hip muscle strength, which may influence pain and injury risk. In particular, female athletes with weaker hip abductor muscles and core weakness may face a higher chance of experiencing low back pain, which often accompanies hip pain. This indicates that tailored core and hip strengthening programs might be necessary to address these concerns effectively. Practically speaking, core exercises aimed at improving hip pain often include movements that enhance pelvic stability and hip muscle coordination. These exercises help redistribute forces during physical activities, reducing wear and tear on the hip joint itself. For athletes, this translates to better performance and a lower risk of injury. Rehabilitation programs for hip pain frequently incorporate core strengthening alongside hip-specific exercises to restore function and ease discomfort. In essence, core exercises are related to hip pain because they strengthen the muscles that stabilize the pelvis and hips. This helps correct muscle imbalances and reduces stress on the joints. For those in sports careers, understanding and applying core strengthening principles is essential for injury prevention, rehabilitation, and optimizing athletic performance.